That's fantastic. You are a medical student. You're director of medical student education for ophthalmology, like we discussed. But even if someone is not going to go into ophthalmology, and let's say they don't meet with you to discuss that as a career path, we are all introduced to you very early on, like we've alluded to many times already, because you are a block director for Physician and Society, which is a longitudinal 2-year course focused on health disparities, professionalism, ethics in medicine. These are all very important topics, but probably a lot of the times under prioritized or not valued as much by medical students as some of the more core components, the medical knowledge that's acquired over the first 2 years. What made you become so interested in these topics? Because it's not something that I think people are traditionally interested in beyond just kind of hearing about or learning about in their process of becoming a physician.
Well, two things in that. First is I am a native Cincinnatian, and the reason that I came back to Cincinnati was because both of my parents became unwell at the same time. And so it really became imperative for one of the siblings to come back to the home front for that. And so for the first time in my life, I had the opportunity to see medicine from the patient's point of view. And I really thought I had won awards for, being a clinician and also. So I thought I really pretty much understood that. Boy, I didn't. And in some cases, I was so impressed by how wonderful and empathetic and caring the physicians were that took care of my parents. And in some cases, I was dismayed. I was truly dismayed. And these were people who knew that I was a physician. And I thought, my goodness, if this is what happens when the treating physician and team understands that I'm a physician, what happens to people who don't have that degree of health literacy, who don't feel comfortable being advocates for their healthcare or family members' healthcare. And so as I kind of reestablished myself in Cincinnati, this course came available. And Physicians Society does deal with ethics and cultural sensitivity, end-of-life decisions, various biases that physicians have. But at its core, what it really talks about is physician identity development. And as you alluded earlier, if you are the same person when you leave medical school as you were when you started, something went terribly wrong during your medical education. And it's not just that you know information, but you fundamentally become a different version of yourself. And how does that happen? And how do you take the aspects of yourself that exist before you come to medical school, intertwine them with the process of becoming a physician, and then come out at the other end of medical school a compassionate, thoughtful, knowledgeable physician that is unique to what you brought to medical school? And Physician and Society is a very integral part of that. How do you think through ethical issues? How do you deal with healthcare disparities? What is really your role in this? What is the role of the physician? What's not the role of the physician? So it has become really quite a labor of love for me to teach that course. It's really quite a joy.